Hello and welcome to the class. The lesson we're learning here is laboratory examination or lab exam. Online. First, we will learn the words and phrases that will appear in the dialogue. Then we study the dialogue and watch a video. After that, we do Q&A to check comprehension. And finally, we do some practice to review and consolidate the learning of the lesson. Here are the words that we're going to learn. Let's go over the list together. The first one, prick. Prick is to make a small hole in the surface of something, sometimes in a way that causes pain. Prick the skin of the potatoes with a fork before baking them. Prick. Number 2, release. To release is to give freedom of free movement to someone or something. He was released from prison after serving 2 years of 5-year sentence. Release. Number 3, press. To press is to push something firmly. Press the button to start the machine. Press. Cotton. Cotton. Many clothes are made of cotton. Number 5, rub. To rub is to press against something with a circular or up and down repeated movement. She yawned and rubbed her eyes sleepily. Rub. Number 6, tube. 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 For example, a test tube or a test tube baby. Tube. 7, elevator. Elevator. Many tall buildings have elevators. You can take the elevator up and down. Number 8, opposite. Opposite. The first meaning of opposite is completely different. You never know they are sisters. They are completely opposite to each other in every way. The second meaning, being in the position on the other side. This is the meaning used in the dialogue here. My brother and I live on opposite sides of the city. Opposite. Number 9, rack. Rack. A rack is a frame or shelf, often formed of bars. Bars, 细细的铁条, that is used to hold things. This is a tube rack. And what is this? A clothes rack. And how about this? An umbrella rack. And this? A newspaper rack. Rack. Now we are done with the vocabulary study. Let's move on to phrases. The first phrase, lab slip. When you go to the hospital lab for a test, the technician will ask you for a lab slip. Number 2, take blood. Example, the nurse may say to the patient, "Please hold out your arm. I'm going to take some blood from you." Number 3, blood draw. Blood draw. This means the same as phrase 2, but it's a noun phrase. The nurse may say to the patient, "Please give me your arm for blood draw." Next, roll up one sleeve. Roll up one sleeve. Again, the nurse may say, "Please roll up your sleeve for a blood draw." Please roll up your sleeve for blood draw. Phrase 5, make a fist. Make a fist. And 6, take a deep breath. Take a deep breath. Number 7, mixturing urine. Mixturing urine. When collecting urine for a test, you should just collect your mixturing urine. Number 8, plastic cup. Plastic cup. You can use a plastic cup to collect your urine. Number 9, name tag. Name tag. When people go to a meeting or join an event, they usually wear name tags so other people can greet them more easily. 10, lab finding or lab report. After you finish a test, you can usually get your lab finding or lab report in a week. Now we are done with the word study. Let's move on to the dialogue. Let's listen to the dialogue first.
Laboratory examinations. The patients go through the hospital lab for a blood test and a urine test, and the technicians tell him what to do.
I'm here for some tests.
May I have your lab slips and healthcare card, please?
Sure, here you are.
Thanks. Please have a seat. I'm going to take a little blood from your arm. Now, roll up your sleeves for a blood draw.
Which one?
It's up to you.
Will it hurt?
Not really, but you may feel a prick. Make a fist and don't move. Take a deep breath. You can release your fist now. Press the cotton ball for 5 minutes and don't rub it.
Can you put a tape over it for me, please?
Sure. Here is a tube for collecting your urine. Please put your midstream urine into this plastic cup first. Next, pour it into the tube to make it 80% full, and then bring it back to the lab.
Where is the restroom?
Take a right. It's around the corner next to the elevator.
Turn right first, around the corner.
Yes, just next to the elevator, opposite the X-ray rooms.
Okay, to whom shall I give the tube later?
This tube already has your name tag on it. Just place it in the rack on the counter.
When can I have my report?
The doctor will tell you the lab findings during your next visit.
Okay, you have listened to the dialogue. Before we move on, I have some questions for you. If you can answer them correctly, maybe you can skip the next few slides on the explanations of the dialogue. My first question is, why is the patient in the hospital? My second question, what does the technician ask the patient for? What does he ask the patient to give him? And next, why does the technician ask the patient to roll up his sleeve? And what does the technician say about the blood draw? Besides the urine test, what other tests is the patient taking? And what are the steps for collecting urine? And where should the patient go to collect his urine? And finally, when can the patient get his lab findings? Now let's move on to the next slide. Let's practice reading the dialogue aloud. Students, repeat after me, please. I'm here for some tests. May I have your lab slips and healthcare card, please? Sure, here you are. Thanks. Please have a seat. I'm going to take a little blood from your arm. Now, roll up your sleeves for a blood draw. Which one? It's up to you. Will it hurt? Okay, so from here, we can know why the patient is in the hospital. Because he is there to do some tests. And the first test he has is a blood test. And that's why the technician asked him to roll up his sleeve. And the patient is kind of worried that this blood draw is going to cause pain. So he asked, will it hurt? The other way to say will it hurt is, will it cause pain? Will it be painful? Well, let's see what the technician says. Not really, but you may feel a prick. Make a fist and don't move. Take a deep breath. After the blood draw is done, you can release your fist now. Press the cotton ball for 5 minutes and don't rub it. Can you put a tape over it for me, please? Sure. The technician puts a tape on the cotton ball. Here is a tube for collecting your urine. Please put your urine Here is a tube for collecting your urine. Please put your mixturing urine into this plastic cup first. Next, pour it into the tube to make it 80% full, and then bring it back to the lab. So, according to the technician, the blood draw doesn't really cause pain, but may cause a feeling of a prick, like a mosquito sting, 就像被蚊子叮咬的感觉。So, to reduce the feeling of pain, the technician asks the patient to make a fist and take a deep breath. And after the blood draw is done, the technician tells the patient to release, to loosen his fist, and ask him to press the cotton ball for 5 minutes and don't rub it. After the blood draw, the technician gives the patient a plastic cup to collect his urine. He teaches the patient how to collect his urine and asks him to bring back the tube to the lab. Let's continue with the rest of the dialogue. Where is the restroom? Take a right. It's around the corner next to the elevator. Turn right first, around the corner. Yes, just next to the elevator, opposite the X-ray room. Okay, to whom should I give the tube later? This tube already has your name tag on it. Just place it in the rack on the counter. When can I have my report? The doctor will tell you the lab findings during your next visit. Conversation, we know where the restroom is. To get to the restroom, the patient needs to turn right first and find the elevator. The restroom is around the corner opposite the X-ray room or across from the X-ray room. After the patient collects his urine in the tube, he then brings back the tube to the lab. And he doesn't need to write his name on the tube because there is already a name tag on the tube. The patient just needs to put the tube in the rack on the counter. And about the lab report, the patient needs to make another appointment to visit the doctor. One useful grammar point to learn in this lesson is imperative. Let's check out its definition and usage. According to Cambridge Dictionary, we use imperative clauses or sentences when we want to tell someone to do something or not to do things. Imperative sentences usually don't have a subject, 通常没有主词, and they usually begin with the base form of the verb, 而且呢，通常是以原形动词开头. For example, have fun, enjoy your meal, stop talking and open your books, don't be late. Here we have more example sentences. They are often used by lab technicians when they are giving tests to the patients. Roll up your sleeves, put your arm on the pillow, take a deep breath and relax. Urinate your mixturing urine into this plastic cup, please. To make this imperative sound more polite, we can add please at the beginning or at the end of the sentence. For negative imperatives, example sentences, don't be nervous, don't worry, and don't rub it. Let's watch a short video on student role play.
May I have your lab sleeves and healthy care cup, please? Sure, here you are, thanks. Please have a seat. I'm going to take a little have to look from your mouth. Which one? It's up to you. Will it hurt? Not really, but you may feel a prick. Make a fist and don't move. 可以问你问题吗？他是让你take a deep breath。应征先测后再接，还是就是先应征先不要，最后先 take a deep breath，然后把先接那个打开，再打开。You can release your face now. Place the cotton ball for 5 minutes and don't rub it. Can you put the tape over it for me, please? Sure. Here is a tube for collecting your urine. Please put your midstream urine into this plastic cup first. Next, pour it into the tube to make it 80% full, and then bring it back to the lab. Here is the restroom. Take a right is around the corner next to the elevator. Turn right first around the corner. Yes, just next to the elevator upside the X-ray room. Okay, to whom should I give the tube later? This tube already has your name take on it. Just place it in the rack on the counter. How can I have my reporter? The doctor will tell you the lab findings during the next visit. Okay, thank you. You're welcome.
It's time for Q&A. Try to answer the 4 questions here orally and using complete sentences. Question 1. What is the dialogue about? It's about taking blood and urine tests in the hospital lab. Number 2. What does the lab technician ask the patient for? He asks the patient for his lab slips and healthcare card. Question 3. How should the patient collect his urine? First, he puts his urine into the plastic cup and then pours it into a tube to 80% full. Question 4. Where is the restroom? It's next to the elevator opposite the X-ray room. I hope you have answered these questions correctly. Now let's do some practice to review and consolidate your learning of the lesson. Practice 1. Word translation. You can stop the video and take a few minutes to complete this exercise. Now let's say these words together. Take a deep breath. Mixturing urine. Plastic cup. Feel a prick or feel a stick. Opposite the lab, across from the lab. Next to the elevator. Blood draw or take blood. Name tag. Roll up slips. Lab findings or test results. Practice 2. Sentence rearrangement. Please put these sentences in correct order. Number 1. The doctor will tell you the findings during your next visit. The doctor will tell you the findings during your next visit. Number 2. Here is a tube for collecting your urine. Here is a tube for collecting your urine. Practice 3. Sentence translation. Please spend a few minutes completing the exercise on your own Sentence 1. Please urinate your midstream urine into this plastic cup and pour it into the tube to make it 80% full. Number 2. It won't hurt, but you may feel a prick or a stick. Sentence 3. Make a fist, don't move. Take a deep breath and relax. Number 4. Press the cotton ball for 2 minutes and don't rub it. Press the cotton or cotton ball for 2 minutes and don't rub it. Now we are done with all the practices in this lesson. I hope you have found them useful in helping you learn the lesson better. In today's lesson, you have learned some important words used for doing lab tests. You have also learned how to carry out a conversation with patients who need lab tests. Students, remember to practice the dialogue with a friend, so next time when you need to run lab tests with a foreign patient, you will feel confident and competent. At the end of the lesson, thank you for joining me. This online course is funded by the Ministry of Education.